You're listening to PetLifeRadio.com.
So welcome. You're here live with Dr. Jeff Werber here, your host for the next 30 minutes on Pet Life Radio's Ask the Vets with Dr. Jeff. We're here for you. We're here for your pets. And, anything you want to ask us, please feel free. You can get us hold of us at 877-385-8882. Once again, 877-385-8882. But better yet, you can join us right here on Zoom. Click on PetLifeRadio.com. Go to shows. Scroll down to Ask the Vets with Dr. Jeff. Click on it, and there's a link left for you there by our wonderful producer, Mark, and he will be able to patch you right in, and you can speak with me live. So if there's anything you want to do, now's the time to do it. And I am with my special guest, Michelle Fern from Catitude.
Hey, Dr. Jeff, how you doing?
Good, Michelle. How are you?
I'm great.
So because of in honor of Michelle and Catitude and my wonderful guest, I wanted to bring in my new kitty. And
he's gorgeous.
So kitty number 6.
Kitty number 6. Wow. What's his name?
So basically what happened was my kids wanted to call him Jazz. My grandkids wanted to call him Jasmine, but Jasmine for a guy, I don't know if that works. So we sort of shortened it to Jazz. So his name is Jazz, and he is just so adorable. I've always wanted an orange tabby, and I've said for years of all the cats, and I have so many cats, is that I've wanted an orange tabby, but I never had one. They're males typically. Mm-hmm. They are very large typically, and they're so sweet. Oh, good, I can eat them up. So finally, a friend of mine's mother found a couple of stray cats in her yard, little teeny kitties, and they had no ID, couldn't find mom. Asked the neighbors, put signs up, and she was worried about them, so brought them in, checked them out, and I said, "Oh my God, it has my name on it. It's an orange tabby." This is like perfect.
Dr. Jeff, how old is he?
Right now, believe it or not, he's only 3.5. He's maybe 4 months now.
He's going to be huge. He's 4 months? Oh, my gosh.
And what's amazing is, so I bring him into this household with 5 other cats and not even a second of battling or hissing. They took him, and he is such a monster eater that I have 2 cats. 2 of my cats are like, one is 16, one's 18 pounds. And they were eating, chowing down their food. And he literally will run up to their bowl, push them out of the way, start eating their food, and they let him. It's amazing. They love this little guy.
He's going to be a big one.
I know. I'm happy.
So sweet. Look at him. He's just like chill and everything.
Oh,
maybe he's made to be on radio or something,
And he purrs like crazy. You can hear his purring across the room. So it's so cute. So how about you, Michelle? Cats wise, dog wise, what's your household like?
I think I think our producer told you I lost my beloved Zeus. He was 15 years, 2 months, and like 4 days. And I had him almost 15 years. I got him at 4 months.
Wow.
And it's just hard. It's hard. He lived, he had a long life and everything, but it's been about 20 days. So I knew it was coming. So it wasn't as bad as when I lost my first one, she was just sick one day and gone.
Right.
So Zeus, I could tell he was slowing down. And then otherwise, the rest of the crew's the same.
Uh-huh. Now, one of the things that I would like to know your take on it, but I get asked a lot. People, heaven forbid, you have to lose a pet. It's very sad. And, so the question is, when do they get another pet? And I used to, I was in the camp that, let a little mourning happen and sort of the memories and then, don't rush it. But you know what I found out, and this is just for me and everybody has a different take on it, is that, who suffers the most when you lose a pet and you don't have another one to shower that affection and that love on? We do. Right. So I'm now of the camp. And as I said, number one, have multiple pets. Believe it or not, it does help the blow a little bit when because you're going to have that emptiness, and the other pets are going to benefit from that because they are going to get so much more affection and love. Then secondly, now I say, I'll wait 20 minutes. I'm looking right away because I don't want to be without them. And my the other animals in the house, and I also have 4 dogs, they've sensed that loss also. They don't want to be without them. So I think that for me, and here's what I say this often, that the best way to memorialize a lost pet is through a new pet. Why? Because inevitably that new pet is going to have some expression, a vocalization, a behavior, something that you're going to be saying, oh my God, Bowser used to do that. And in that way, you just never forget him. You're not going to forget him anyway, but it just brings back nice memories.
You don't forget. When I lost my first one, it was just me and her in the household. So when she passed, I was devastated. I went looking right away, and it was in 2005, and we had a hurricane coming up. So I knew I would be, and it was Hurricane Wilma, which was a bad one. So I knew I'd be stuck inside all by myself. And it wasn't that made me spur me to get someone else, but it was just the loss of her, was because it was her and I. That's the only live things in the household.
Right,
so
right.
I had to find another dog right away, and I wanted to rescue. I actually went back to the same shelter that I had went to at the Humane Society. We have one here that has like 4 kennels, and I went back, and there was Zeus. I found him, and he ended up being returned to the shelter, and he had the stupidest name, Binky. That's like what they used to call a pacifier, right? I mean, and the lady told me they returned him because her child was holding on to the bone as he was chewing it, and he growled. We all know dogs just do that. And, puppies, he was a little puppy, 15 pounds, 4 months. He was adorable, scared, a little skittish of me. And, I had posted some pictures on Instagram, and they were unfortunately not the best quality because 15 years ago,
right.
Phones, cameras weren't the best, but he just was this ball of fluff, and him and I that was our first night together. So that's why I named him Zeus. It was either Zeus or Fred, but it was just so much better once I got him. Now this time I have a whole zoo. I have 3 cats, 2 outdoors that are TNR rescues, 2.5, I say. And then we have the yapper, Nikki. So this time I'm holding off a little because with COVID, it's a little harder to adopt. And I don't know if I'm going to be traveling a little bit next year. So I'm just holding off. But I think when people say that it was so hard going through the loss, I'm not going to get another one, and they don't have other pets and they don't have any reasons, I just don't think that makes sense to me. Get another one, especially if you're rescuing. I'm so big on rescuing because there's so many pets out there that are not wanted, unfortunately. Especially, and now with the COVID, people were adopting like crazy. Now I heard they're starting to bring them back to shelters, which is horrible.
And that was the fear. In fact, I wanted to talk to you about that because I'm hearing the same thing. First of all, the shelters are emptying out, which is a good thing. And yet my fear was that as we hopefully get back to some sort of normalcy in our lives and going back to work, are these adopted pets going to be taken back to the shelters? And how terrible that is. So,
that drives me crazy. It's like taking your kid and bringing your kid back.
I know, right?
You don't do that.
So because I'm also, what I'm seeing is veterinarians we are getting so swamped. And I think part of the reason is, number one, more people are getting pets, which is good. And also we're spending more time with them because we have more time to spend with them. A lot of businesses are not essentials. So they're not being allowed to go back to work, for one thing. And secondly, those that have not been going to work and have been doing things virtually, they're realizing, oh my God, we can do this. We don't need that expensive office. We can do this on Zoom. We can do it on home. And I know a lot of companies are downsizing, and a lot of the employees are going to be remaining, possibly working remotely. So if that is the case, then I think it is good for the pets. But my fear is those that do go back, they're going to find out they don't have the time. The animals are going to become destructive. They're not going to get the attention, and they're going to take them back to the shelter, which is terrible.
It is terrible. I mean, for dogs, it's a little harder for dogs to be separated, but for cats, they're fine with it.
Yeah, of course.
Overall, from everything I've heard and listened to lately, cats are, okay, hey, you're gone, fine. You're here, fine. Just give me a little time and feed me and take care of the litter box and I'm good,
Right.
So they're fine. You know what I want to talk to you about? There's so many schools of thought on this. Indoor versus outdoor cats, because I have both, but let me explain. My 3 indoors have always been indoors, and they have the patio, which is the catio, so they can go outside there. My outdoor ones are 2 TNR rescues that we didn't just rescue and feed. They have a house. They have a warming blanket for the 2 cold fronts that we get down here in South Florida. They have flea treatment, but they're a couple. So she would not be good indoors. He would be, but I can't separate them. So they're outdoors because of who they are. But what do you think about, like say Jazz, would you ever have, or your cats, are they indoor, outdoor to come and go as they please? Or what are your thoughts on that?
I think a lot depends on a lot of factors. Number one is the location. Statistically, if you live in a metropolitan area, outdoor cats don't fare as well. In LA, for example, with dogs, cars, coyotes, feline AIDS, feline leukemia, they are at a big disadvantage. They say the average age is they can live up to 5 years. Whereas the indoor cats, I've had cats that have gone 17, 18, 19 years. So my cats, 6 of them, all are indoor only. And I've always been a fan of indoor only cats. I think we have more control over them. And I think they fare extremely well. And by having multiple cats, they still have plenty of room to run around. And we have a patio as well. And sometimes I'll let them out. And they really don't fare. They don't go very far at all. They're always in the backyard. Often in my neighborhood, I'll see signs up about a lost cat. Now, the advantages of, well, obviously, cats that are indoor, outdoor, or outdoor only, they're very smart. They have that survival instinct and they do very well. One thing is that when you have a cat that's outdoors, I see people, because it's somewhat of a norm to see cats just walking in the neighborhood, crossing streets, etc. Those that are lucky enough to make it all the way across. So no one's going to stop when you see a cat, whether it has ID or not, and try to capture it, which will be almost impossible, and bring it into the shelter. Whereas dogs running around by themselves, the first thought is, oh, he got away, he must be lost. So people do try to lasso him, get him into a car, and see if there's any identification on him, etc. So my last batch, one of my cats was a magnificent Bengal, snowshoe marble Bengal, one of the most stunning cats I've ever seen. And he got out once, and he was gone we thought he was gone. 5 days, all of a sudden, one of my dogs is outside and going nuts, like vocalizing and barking and jumping up and down. So I look out the window. What's driving him crazy? And it was Zoolander. Zooey came back.
Wow.
5 days. So now what I learned from there is, even though all my cats are indoors, they are all microchipped, and I do have them wearing collars. So I just don't want to take a chance. You guys have hurricanes. We have earthquakes. Heaven forbid. They've done it recently. I walked out by my patio, looked out the window, and 4 of my cats are sitting on the patio. How'd you guys get out? They pushed a screen out and from the kitchen, jumped out the patio. They were hanging out, but just holy cow. So you realize that you need to take the precautions.
I always worry too, if they're out and about, even though they can take care of themselves, if they were always outdoor, there's creatures out there, like you said. We're in the suburbs, but still there's coyotes around here. There's possums, there's raccoons, there's some of these bullfrogs that are huge that are supposed to be toxic to animals. So I'm concerned about if I had my indoor cats become outdoor cats, that they would catch something. And that could be maybe transpired to, I don't know if that could hurt the dog or not, or I don't know. That's my concern.
And there's also, in our neighborhood, we see a lot of these poison mushrooms growing on people's lawns. And, for an animal who's foraging, they might just eat those up. And there are terrible stories about those mushrooms. So I'm very happy to keep mine indoors. They have, the run of the place. They have big beds to lie down. They have their own beds. So, in fact, it's so funny. One of my cats, an outdoor rescue, more as an adult cat, his name is Ninja, Black Ninja. He's one of my big ones. And he is just an amazing cat. So when we first brought him home, he would sit by any door waiting for it to open so he can charge out. So we were being very careful. We started feeding him. He started playing with the other cats, and he started, he actually bonded to and he bonded pretty well to Jazzy as well. Anyway, it got to the point where we can have a door wide open and walk up to the threshold, peek out, look out one side, look out the other side, go, nah, what's better in here? He has no desire now to go outside. So that's great.
How come he has no desire to go out? What happened?
No, just because he started realizing, wait a second, I get meals, 2 big meals every day. I'm getting all this attention and affection. I got all my playmates here I need. And there was nothing out there. It could be this. And anyway, he has turned out to be such an amazing cat. He's one of my most lovable cats.
Well, cats are smart,
Oh, yeah.
They know.
So wait a second. Let's talk to a cat lady here. So what do you think? Who's smarter, cats or dogs?
I was always a dog person until I started getting cats. And then, now I have more cats than dogs. I don't know, but I think I've heard that cats are.
Here's my take.
Depends on the dog, the breed too.
Of course. Oh,
I think mutts are the
individually,
best.
But I'm generalizing. I'm going to generalize here. First of all, you have to define what is smart. Who is better at being taught tricks? Okay. Dogs.
Probably dogs.
Oh, absolutely.
Dogs
But
are harder.
if-
Cats can be trained by now, but they're a lot harder
absolutely,
to train.
absolutely. But I'm not. Yeah. But if we're going to define by smart as a survival instinct,
Cats.
Cats hands down. If you put your dog outside, your domesticated pet dog, and lock him up out of the house and see how long he makes it on his own, smarts, left to his own devices, as we say. Whereas a cat, God, no problem. I'll eat bugs. I know where to go. I know how to avoid cars. I know how to look both ways. I know the noises. They could do better on their own than a dog.
Right. And I
So
wonder
that's
if I've heard also it's because dogs have been domesticated longer too.
Totally possible. Totally possible. But so that's why I never like to enter that discussion, because you never know.
I'm a little of both cat and dog. So if I was strictly cat, yeah, I'd be rooting cat.
All right. So don't go away, because we have more to talk about here with Michelle Fern from Catitude. And it's great to have a cat lady on, because I'm a cat guy. So, it's good to also have a cat lady on. So don't go away. We'll be right back with these short messages, and we'll have more fun with Michelle.
Looking for a dental treat that does more for your dog? Daily Dose is a 2-in-1 chew that pairs a daily dental scrub with powerful supplements to help with the biggest health concerns facing our dogs. Daily Dose was developed by vets to be simple to use and super effective. Plus, dogs love the taste. Available for joint, skin, heart health, or calming. Daily Dose. Your pet's daily dose of awesome. Visit yourpetsdailydose.com to save $3 on your first bag with promo code PETLIFE. That's yourpetsdailydose.com.
So now I've got this pack of 4 Shar-Pei rescue dogs for, oh my goodness, probably 5-6 years. They get a regular diet of Dinovite with every meal.
DINOVITE.com.
People remark on what beautiful coats they've got. I tell them, you don't need to wait until a problem presents itself. It's far better to keep the dog happy and healthy at all times.
You won't believe how happy your dog will be.
I get my Dinovite from DINOVITE.com.
Are you listening to this right now with a cell phone clenched between your teeth as you frantically flip pages on your paper calendars? Or are you a new breed of groomer, bred for speed and efficiency of movement? 123 Pet software automates your communications, doing the reminding, confirming, thanking, and marketing for you. 123 Pet centralizes your schedule, employees, clients, inventory, and more. 123 Pet is the business management software you need. Start minding your business today. Visit 123petsoftware.com.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
We're back. So we're back here live with Michelle Fern. And we're going to talk about some more about cats. We can talk about dogs too. And also, let's talk about vaccines.
Let's talk about vaccines because, it's hard when you have 3, 4, 6, 7 cats and there's so many different vaccines. Now, you're a vet, so it's different for you. But for the average person, when you have all of these cats, it adds up. So are there vaccines that are necessary and there's vaccines that are okay if? So that's what I want to know. Okay to get, you should get them, but you don't have to have them.
Correct. So here's the thing. We divide them up into what we call core vaccines. Those are the essentials. And those are based on really where you live, what the lifestyle is. For example, I have indoor-only cats. Okay. Am I worried about leukemia virus for an indoor-only cat? The answer is no. Now, certainly if I were going to take a new cat, like when I did with Jazz, we test him. He's negative. And so therefore, I'm safe to bring him in. But when you think about leukemia virus, in order for transmission, it requires prolonged direct contact with a leukemia-positive cat. I'm not talking about casual, you walk by them and sniff each other. I'm talking grooming each other, sharing food bowls, sharing litter box. It's got to be living together. So the chance of that happening with my 6 cats are nil. Therefore, I don't vaccinate. Let's talk rabies. How do you get rabies? In order to get rabies, you have to be bitten by a rabid animal. Again, where are my indoor-only cats going to, well, first of all, where am I going to find a rabid animal in Los Angeles? We haven't had a case in 50 years. And then how is that dog? I mean, I'm not inviting bats into my home. I'm not inviting rabid raccoons and squirrels and coyotes into my house.
No, you have enough going on anyway.
I know, exactly.
So you don't need them, right?
So am I worried about my cats? The answer is no. Now, having said that about rabies, in some states, in many states, I believe Florida is one of them, rabies vaccine is required for cats as it is for dogs. Therefore, you have to do it because it's required by law.
It is required. And you have to,
in California, it's not required.
Just the vet appointment, because a lot of vets tag on the office visit, they don't have vaccine clinics. You're talking about $120. If you go to a shelter like the Humane Society, but now it's, strange times. So we're dealing with COVID still. So you're waiting in your car. Hope there's not a long line. Then it's about $40. I know that the money goes to a lot of the shelters for the tags, but yeah.
So now let's talk about some of the more esoteric, vaccines. So we go, the FVRCP, which is the feline vaccine for rhino, caleci, panleukopenia, which is cat fever, and also I like the chlamydia pneumonitis. That would be core for LA because that does not require direct contact, and you have cats running around, open windows, so that would be something that is what I would recommend required. And therefore, we do that one. But that has gone from a 1-year vaccine to a 2-year vaccine, now it's a 3-year vaccine. Has the vaccine changed? Not a bit. What's changed is our knowledge about the immune system and how long these animals maintain immunity. And I know for dogs, what I do for the distemper parvo is I'm a big advocate of titer testing. So they're adequate. I don't vaccinate. I am not one of these vaccine guys. I mean, core vaccines are needed, but if they already have immunity, I'm not going to vaccinate. And then think about like for dogs, more rattlesnake, Lyme disease. These are vaccines that basically are lifestyle vaccines. If you are going and hiking in the mountains with your dog and there are rattlesnakes, yes, you should do the rattlesnake vaccine. If you're in the Northeast and Lyme disease is prevalent, yes, you should have the Lyme vaccine. So it all depends really on your lifestyle. What is the potential for contagion? If the potential for contagion is minimal and the risk of getting a vaccine is more than even the potential for contagion, then don't give the vaccine. Perfect example, coronavirus. Here we go with coronavirus. We had to bring it up once in a conversation, but the coronavirus in dogs is basically a 24-hour stomach flu. It is not deadly. It is not dangerous. And yet the vaccine is one more vaccine where the adjuvant or the preservatives can actually cause some sort of vaccine reaction. Do I want that? No. So I'm not an advocate. I don't recommend corona vaccine for dogs. So it really just depends on your veterinarian, your own philosophy, your lifestyle, your location. And that's kind of how I make my decisions.
I love your decisions and I love that. And I know that you're the same in your practice. You don't shove everything down just to make the sale. And I find that so frustrating because vets can be expensive, and especially when you have multiple fur babes. So what can you as a pet parent, if there's a vaccine that you don't think is necessary, you've done research, your cat's indoor only, and you really don't think it's necessary, how can you approach your vet and say, I really don't want to give that? Because a lot of the older, and I'm not so biased, I've had this happen, old school vets, which have been practicing for, maybe 10, 15, 20 years or more.
It's okay. I'm in my 37th. I changed.
Yeah. Well, I prefer old school vets, but there's a lot of new vets that are great too. So there's that too.
Yeah.
But there's some that are, just pushing, the vaccines just to get the sales at the clinic. What can you do as a pet parent? Just say, no,
absolutely. Just say, no, I'm sorry. I've done my homework. There's no chance that my cat's going to get it. Therefore, I'm not interested in that vaccine. You could say, you know what? Why don't you go talk to Dr. Jeff?
I wish we could clone you. Can we have a Dr. Jeff clinic, And I mean, you're in LA. It's better weather than South Florida for the most of the year, but the one down here
today.
Or we can move there. That's better.
And another thing, I'm so glad we're on this subject of vaccine. With vaccines, I had a discussion with a human immunologist. My original thought was that I don't like giving too many vaccines at once because the body can't handle the antigens, the body's immune system. And he straightened me out and he says, no, the body can handle millions of antigens at once. The reason why we don't like doing it on the human side, and I started using this as my reason why I don't do it on the veterinary side, is when a cat or a dog has a reaction to a vaccine, it's not the vaccine itself. It's not the antigen itself, which is usually an attenuated antigen. Okay. It's weakened. It doesn't cause the disease in the pet anymore. Okay. It's even sometimes killed or it's modified live. So whatever. What does it? It's the adjuvant and it is the preservatives. That is the liquid part. What the antigens are floating in that little bottle, that 1 cc or half cc bottle, that's how they get the reaction. The more vaccines you give, the greater your likelihood of vaccine. And speaking of vaccine reactions in cats, let's talk about the vaccine-induced sarcoma, that cats can actually get a cancer from the injection. All right. So when you have vaccine-induced sarcoma, that's why, if you've noticed, and if your vet is doing it elsewhere on the body, they should be changed. You should let them know that we no longer vaccinate cats on the trunk. We vaccinate them in the extremities, in the limbs, in the thigh, in the shoulder. Why? Very simple. Because if, heaven forbid, they get this vaccine-induced sarcoma, you can save their lives by amputating. Whereas if the vaccine is given somewhere on the body, on the trunk, you cannot amputate. And these animals ultimately are going to be put to sleep. It's very sad.
That's really interesting. Who would have thought? Okay. I know our time's almost up, but I want to ask you this because, we're going to another topic here, but you've been practicing for how long?
I'm in my 37th year.
But you look like you're 25. So how do you do it?
Thank you. I have grandkids already.
Wow. So you're the perfect one for me to ask this to, because on Catitude, I hear a lot of people, say, well, I don't like this vet. I chose this one. They'll make comments about vets, but I'm always interested and curious, and especially to hear from, a vet. I hold you in high regard, and I know you've been, like you said, you've practicing 30-something years. What is your peeve on pet parents that come in to see you? What are some of the things that just drive you crazy?
Most of the things that drive me crazy are really, it's our fault, the profession's fault. Lack of education, lack of knowledge. What does get me a little crazy is when I see a problem, and as you mentioned, I'm very conservative. I am not a panicker. I like to educate. I like to give people choices. I'm not one of these that says, no, this is the way we have to do it. Like I said, if we could afford anything we wanted, we would have anything we want. The practice management consultants always say, well, it's not our job to look in the pocketbook. It's our job to provide the best care possible. I disagree. All right. I think we need to look in their pocketbook. And our job is to tailor a treatment plan, a diagnosis plan based on what they can do. You don't want anyone ever walking out of your hospital in tears, thinking they can't provide the care for their pet just because they can't afford it. Our job is to find out their Chevrolet, their Toyota, their Mazda. Not everybody can have a Porsche or a Rolls or a Bentley, right? Or a Tesla, because we'd all be driving them. So I'm not impressed by a doctor who can run every test in the book and give me the right answer. I am impressed by a doctor who can't run every test in the book, but still gives me the right answer. That's a doc who actually took every clue, the history, the physical, and he ruled out over half the things just by nature of that alone. Don't test for them. And that's a good doctor. I think that all young doctors should go get episodes of House MD. Remember that show?
Yes,
right?
yes. It was great.
Learn about diagnostic medicine. Learn how to take all the clues and then ask yourself for all your differentials out there. Every disease that you thought are possible, now go backwards. What would you expect if you had a pet that had that disease? And you run down those clinical signs. And then you say, wait a second, of all those clinical signs, this pet only has one of them. It's still a possible. It's always possible. We're putting that down below. We're not tested for that one right now. And you do it for each and every disease on your list of differentials. And then by that time, you're done with, instead of having 10 differentials, you only have 2 or 3. That's what you test for.
That's smart.
And that's how I think. So my pet peeve is really against a lot of my colleagues who, like you said, I think are maybe a bit overly aggressive when it comes to testing. And I think that's the fault of the vet schools. The young doctors are so, because they've had these things from the school. They've had ultrasound, right? They had all these fancy tests. They've had dental x-rays, et cetera. And I'm thinking to myself, well, we didn't have that. So we had to learn how to be better diagnosticians with our ears, our nose, our hands, getting a good history. And I wrote an op piece about this, and I was expecting ticking, packages in my mail, right, from the profession. And I got so many letters of kudos, mostly from older professionals who finally said, thank God someone is standing up and not letting our diagnostic skills die with the profession.
I want to also hear from what makes you cringe from a pet parent's behavior. So pet parents that come into your practice, and what do they do that drive you nuts?
And one more thing, Michelle, that drives me nuts as a provider of care is when you do your best job, you are working with the client, you're doing your best job to make it fit for them so they can do it. And they still come up with these lame excuses. Why, no, we're not going to do it. And you know that the animal is going to suffer. And
that's it.
Oh my God, it drives me absolutely nuts. But unfortunately, it still happens. Or, you know what also drives me nuts? Breeders. Because we don't really need so many breeding dogs right now. But it's not that. There's so much has changed in the veterinary world. When I was a hotshot student 40 years ago, one of my mentors said to me, Jeff, yeah, you're a hotshot. But guess what? Every 5 years, half of what was gospel is going to be obsolete. So don't forget, you need to learn every day. You need to change. And I'll talk to these breeders, and I see vaccines given at 6, 8, and 10 weeks. And I call them, I'm going nuts. Do you realize that 6-week vaccine, the one at 6 weeks, is going to interfere with mother's passive immunity and actually leave them with no protection? We've learned so much more. So I call them very nicely. And I say, I'm just want to let you know, there's a lot of new things in the vaccine world. And now we're vaccinating at 8 weeks, at 12 weeks. We don't do it every 2 weeks or 3 weeks or 4 weeks apart. It's great, et cetera. We want to start at 8 weeks. We want to finish at 16 weeks. And I get this. It drives me nuts. Listen, son, I've been doing this for 40 years. And I know what kind of do. I know what I do with my dogs. So I'm just going to keep on doing it. And it's like you want to say, oh, God, what am I going to do? How do you fight that? And you can use all the logic, all the reason in the world. And these are, they got their blinders on. They think they have all the answers and they're not learning. We have to change with the times because there's so much newness in medicine all the time.
Well, just think about people, for us as humans, we go to the doctor. There's been so many changes over the years too. So why wouldn't there be for, in the animal world, why wouldn't there be the same changes? Nothing,
absolutely.
Things change. And I'd be frustrated, breeders too.
Yeah. Yeah. And there are a lot of good ones. In fact, I often comment when I see the paperwork for a breeder and everything is right. And they say, they put in advance, okay, 4 weeks, we did this shot at 8 weeks, 4 weeks and 4 weeks. They put the date out. I said, oh my God, thank God somebody is actually up with the times and learning some of the new things we're doing. So that's great.
Okay. I have one more question based on one of the things that you said frustrates you, because my vet does this, and I think what you had mentioned as far as giving choices, we could do this and this or this and this. When you have one fur babe, you could sometimes go the whole route, maybe cut out one or two things. When there's 6, you have to make choices sometimes, right? Because you could, spend who knows how much. But what do you think, just offhand, vet only costs? I know you're in LA, so it's a little more expensive there because I live there, so I know. But what do you think the cost is for shots and upkeep annually for a cat?
So it depends how many vaccines you give. Let's say the average vaccine is between $25 and $30, okay? Plus a visit. You need, let's say, assume you can do one visit a year. Again, depending on location. I have visits as low as $50, visits as high as $90. And then multiply that by the vaccines and the annual vaccines. And remember, some of these vaccines are not annual anymore. The FVRCP is every 3 years. You can do a 3-year rabies. You can do a 1-year rabies. The 1-year rabies, I think, is a better vaccine, but right now it's only approved for a year. So sometimes it's just a matter. You can spend, let's say, if you do one essential visit a year, the average person only sees a vet 1.6 times a year. So let's say it's 2 visits a year. Let's say let's average $150 on visits, and then let's say vaccines $25, $100 of vaccines. So you count on maybe $275 a year, depending on the cat. And then as they get older and they need dentistries, that's where it starts getting expensive because you're going to need some lab work. You need a dental. We're relatively inexpensive. I've heard some places quoting for full dentistry with x-rays close to $1,000. Well, it's crazy.
I haven't done cats dentistries, but dogs, yeah. Because once you do blood work.
You got the blood work, your dental x-rays, the dentistry itself, depending on what was done in the dentistry, you might have some medication to go home. It could be upwards of $1,000. Crazy.
Well, something to keep in mind for,
right.
Cat owner. Dentistry, you should do it. Do you think absolutely necessary for cats?
Oh, absolutely. Because cats get something called cervical line lesions, and it's like a decay at the point where the tooth meets the gum. Very painful, very painful. And if you have, for example, you see your cat pick up food, and then they want to chew it, but they open their mouth, they drop it. Have their mouths checked because that might be one of the problems. Very tender.
So it's been wonderful talking to you, Dr. Jeff. Thank you so much for having me.
All right. Well, you know what? And it's been great having you. Thank you so much for joining me, Michelle. I'd like to do this again. Anyway, always, if you need to get a hold of me, Dr. Jeff at PetLifeRadio.com. You can follow me on Instagram at Dr. Jeff Werber. And of course, as we mentioned, if you need to get a hold of me, log on to AirVet. Download AirVet 24/7 concierge care. And if you put me, Jeff's Telehospital, as your primary hospital, you'll get me as your personal concierge doc. Have a great week, everybody. See you next week.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.